A very good morning. Today I'm back with a very interesting clinical scenario. You can see it has integrated so many subjects. Let's go straight away into the scenario. This is my bar disclaimer slide. This is a 25-year-old male. He came with abdominal pain, described as vague pain, no vomiting or fever. There was no positive history that can pinpoint to any other system or to any system in the abdomen. Please don't look at this marking for the time being. General examination is unremarkable except a little attitude and restlessness. A 25-year-old is likely to behave like that, more so when his complaint is pain abdomen. Okay. While you're examining, he says an enema may help. You're not even finished your encounter with him. You're just examining him. You order an X-ray abdomen actually without a working diagnosis because you didn't find anything much. Neither was the history forthcoming. Was the examination, was he cooperative? Only thing he kept saying, can you give me an enema? What do you find? Have a look at the X-ray. I think most of you have already found out. You can see multiple radio-opaque shadows and they are very almost well defined. If it is fecal pellets, the edges will not be well defined. And you can see them, they are almost geometric shapes. Fine. So what do you find? You find opacities but with geometrical shapes. That is most important. It can be a square, a rectangle, a rhombus, but usually it's a geometric scale with well-defined edges. So this is body packing. Very common question in your forensic. When I was going through your NEET PG questions, I realized why not bring out my own clinical experience, which I used to have about 25 years ago in the country of Qatar. Now, you're likely to find body packing in countries where narcotics are strictly controlled, like the GCC, Gulf Cooperation Council, and Singapore. Other countries too. But here, when you work as a doctor, you're likely to find this much more. So, this is talking to Indian students who are planning to go abroad and also my audience, which is placed in Singapore and GCC countries. Now, a young patient asking for an enema, even before you can finish with your questioning, is a giveaway. Impatience in answering probing questions. I was asking only simple history. There's no need to get impatient with it. We were not asking him theory of relativity or the quantum mechanics. Just simple history, he got irritated. So now coming to body packing, there is a social, economic and legal issues. We are not concerned with that part at all. We are concerned with dangers to the patient himself. But the moment you find body packing as a doctor, you need to involve the lawmakers. Then the rest of the problem is theirs. But as a doctor, when you find body packing, apart from treating him, you need to get in touch with the law authorities and your action stops there. What about dangers to the patient himself? Packs can rupture, leading to acute poisoning and death. Can cause intestinal obstruction and its sequelae. Sorry about that spelling mistake. So we talked about bioethics. This is where this is where your bioethics comes in. And this is where your surgical and medical management enter. So you can see the integration of various subjects and your medico-legal responsibilities of informing there. Now, As I told you, packs can lead to rupture or they can cause intestinal obstruction. So what do? You can manage conservatively and let the bowel motions go on as usual, or whole bowel irrigation or surgery and removal. In case you find you have a suspicion packs have ruptured because of tachycardia or because of other signs of acute poisoning, you might decide to go in. Or there may be features of intestinal obstruction. What is whole bowel irrigation? It is given with a the drug called polyethyl glycol. That is what is given before your colonoscopy. It will remove the complete feces from the colon and intestine. Now, when you give this, unlike your laxatives, like your liquid paraffin or other laxatives, they will cause not that coordinated peristalsis, cathartics. They will not cause coordinated peristalsis and pack rupture can happen. But polyethyl glycolin will cause a very smooth transit of the feces as well as the packs outside. And it reduces chance of packet rupture. What did we do? We managed only conservatively. This was 25 years ago in Qatar. What we did, we managed conservatively. That means we keep them in a room. It is isolation room because the police personnel will be with them throughout. They will even follow them to the lavatories, to the toilets. And packets will be retrieved. Not only that, the police will be behind him, one, to catch him, to catch the packets, and to catch the dons behind this drug trade. So that is why the police are there. So naturally you will have to interact with them. You need a fair amount of tact and patience to answer their questions. After 72 hours, most of the packets have come out. So this is the case capsule, and I did try to cover as many subjects as possible. Please keep all this in mind. Thank you.